your background, Dr. Tien. It's great to hear that you yourself had a procedure done, a vision correction procedure done, and you can now serve and help other people. So, what specifically about RLE that draws you to that? What makes you excited to do surgeries every single day?
About RLE. I really like RLE. I seem to do really well at RLE. I think a lot of other surgeons kind of are scared about it. Not sure what the reason is, but I was the highest volume cataract surgeon for a little while up here in Washington, for about 2 years. And so I got really comfortable doing the surgery. And then RLE is simpler than cataract surgery, as you can imagine. A lens that's not hard as leather. It's pretty soft. It's much easier to remove. So it just clicked like that for me. For ROE surgery in the last 10 years, we now have, just the most amazing lenses that just restore your vision to what it was, when you're 20, 30 years old. And so we get to use those and restore, you know, eyes back to their age of 20 or so. Um, yeah.
Well, great. Well, thank you, Dr. Tien, for sharing why you're so passionate about RLE. And that goes to our first question. What most people are wondering is, what is refractive lens exchange? I've heard of cataract surgery before, but I'm not familiar with refractive lens exchange. Can you kind of walk us through the difference?
Yeah, you bet. So RLE surgery is a form of vision correction. It gets you out of glasses. So freedom from glasses for your distance to your near vision, by replacing that aging human lens with an advanced technology lens specific to your eye. So I'm going to pull out my model here. There's two positions on the eye where you can do corrective eye surgery. One is here in the front surface of the eye. And that's we do LASIK, PRK over here on this tissue over here. And the second place where we can do corrective, uh, you basically get rid of your prescription of your eye is in the lens of the eye. So that sits, inside the eye and behind the iris. So the front of the eye and then the lens of the eye. Sorry, I don't know if you can see that. Ed has a better picture there. Um, okay, in LASIK, we use a laser to reshape the front surface of your eye for vision correction. And in the lens, we remove the lens and replace it with a brand new lens that's specific to your eye, gets rid of all that discoloration that you've accumulated through your lifetime, and we correct your entire range of vision, which is your near all the way out into your distance. Um, Ed mentioned cataract. So cataract is what happens with time. So once you're in your 50s and 60s, that lens, that clear lens inside your eye, that's inside my eye, becomes cloudy. It becomes really hard. So it's no longer able to work with the muscles inside the eye to focus light, and it becomes pretty dysfunctional. So at about age, 45 onwards, a lot of people go into bifocal glasses, or they do monofocal contact lenses, sorry, monovision contact lenses, and they, kind of struggle through those years. But we have a pretty great option now to get you sorted out for the rest of your life. So that's RLE. Um, Okay, so if you're treating the front of the eye, um, which is LASIK, a lot of folks come in here wanting to have LASIK surgery, but it doesn't address that aging dysfunctional lens that's inside the eye. That's still gonna, keep getting more dysfunctional. You're gonna run through a bunch of glasses. You're gonna need bifocals, trifocals, progressives. So beyond a certain age, it becomes a better idea to put in a lens implant rather than to do LASIK. So, like I said before, the lens technology these days has improved so significantly. And in just the last 5 years, we can completely correct your vision, and give you back that range of vision that you're lacking in order to see just everything from the distance all the way up to about, 10, 12 inches from your face. Um, so just to summarize, so for people who are struggling with those reading glasses, you may never have worn glasses until now, bifocals, progressives, then refractive lens exchange is a really good option. This is a procedure that is your final procedure, and the eye's prescription will not change for the rest of your life. So So that's something that you won't find with LASIK or any other procedure. So with that, we can offer vision correction to you at any stage in your life.
Great. Well, thank you, Dr. Tian. I actually have a question. The next question is actually who's a good candidate for RLE? But before we answer that, can you just talk about, what is near vision problems, right? What is presbyopia? I think, some of our listeners out there, some of our viewers may not even know that they have that problem. So, as a surgeon, how do you explain to patients like you actually aren't able to see because you're getting older, right? You have a couple more birthdays than you're used to.
Exactly, Ed. It's part of aging, and it's the natural course of aging inside the eye. So if we talk about aging of the skin, you get more wrinkles. And when those wrinkles are starting to show up, you can bet that inside the eye, things are changing as well. So inside the eye, you have that lens. Um, it's very soft and clear, and you have muscles around the lens that tighten it up and change its shape in order to best focus light. You don't even have to worry about that. The brain controls those muscles. But after age 45, all of us, doesn't matter how healthy you are, it's just a matter of, being alive for so long, being exposed to natural sunlight. This lens starts to harden and it starts to change its shape. So even if you had corrective laser surgery like LASIK, you'll find that the vision at that point will start to change. You're back in glasses at that point. But for those of us who never wore glasses up until about 45 years old, you're bound to be at some point around there in bifocals or reading glasses that you have to take on and off, or progressives that, hard to work with. Really, if you're looking that way, it kind of like gives you a prism effect and just kind of throws you off balance. So there's a lot of issues that I've heard our clients tell us, but this effectively gets rid of all those issues by just taking out that ever-changing lens inside your eye that's starting to discolor and harden and change shape and put in a what do we call it? A forever lens that will last you for the rest of your life, but at the same time correct all of your vision needs from about 10 inches, like I said before, to all the way out into the distance.
Well, that's amazing. Well, thank you for sharing your perspective about that. And that really ties into who's a good candidate. I know at IQ we really want our goal is to make sure patients are happy, right? Regardless of whatever procedure they choose to move forward with. So from your perspective, as a surgeon, who are the good candidates for the procedure?
That's a great question, Ed. So yes, we want our patients to be happy, and if we determine that you know someone has really a different idea about RLE and have expectations of being able to see craters on the moon or something like it's a telescope, then we kind of we got to be realistic about what this does for you. So if you want to be out of glasses, that's very realistic. 100% of our patients are out of glasses in RLE. Um, So, I would say the best candidates, basically, let's start here. Anyone can do the surgery over age 45. It is not opinion, but just if you can think of someone in your family who's had cataract surgery, you'll know that they had a lens implant with that cataract surgery. And it doesn't matter, who gets cataract surgery, we always have a lens ready for you that's made for your eye. And that's no different for RLE. So anyone can have one of these lenses implanted in their eyes after removing their natural lens. I would say the the perfect candidate for this surgery is someone who's relying on glasses. So if you count the number of hours that you're wearing glasses in a day and it's beyond about 2 hours, I would say you're a great candidate. But if you don't read a whole lot, you don't need glasses except to read, I don't know, something like the menu at a restaurant or something. You just use your eyes to read for, a minute or so a day. You may not need the surgery. At that point, you can probably just take a photo of the menu with your phone, blow it up, and take a look. So I think it's a matter of convenience. The surgery really will provide that convenience to you so you're not fumbling around for glasses or contacts. So let's see, did I miss
Great.
anything?
No,
But
I think you covered everything, Dr. Tin.
okay,
And just for viewers out there, we offer a free consultation to see if you're a good candidate for the procedure. So
oh,
for the audience today,
sorry to interrupt, Ed. I did want to just clarify. RLE surgery, for the most part, in order to, almost fully expect to get out of glasses, you have to have healthy eyes. So if you have some kind of severe eye condition, RLE would not be appropriate. But if you just have like a minor diagnosis, dry eye, something like that, or even some mild glaucoma, mild macular degeneration, absolutely RLE should work just fine. But for severe eye diseases, probably not a good idea.
oh, and that's a really good point, and that's where at IQ we offer that free initial consultation just to see if you're a good candidate, so that we could screen out any other eye conditions you might have, right? Whether it's retina related or macular related, as Dr. Tian mentioned. So thank you for